Hey everyone, I'm really fortunate today to be here with two special guests. Well, actually, my co host, Megan Ethridge in Louisiana. Hey Megan, glad to have you here.
Hey, Lauren, so excited to be here for this episode today.
And Megan and I've invited Ashley Dalme to join us. And Ashley is a client of mine, and she is also Megan's neighbor and a member of Megan's Gemma Moms group in Louisiana. And the reason I invited Ashley here to join us is Ashley has a really cool story to share about changes she has seen in her own children working with gemmotherapy to restore their immunity. And so, Ashley, what I'd love to hear from you is just a little introduction to each of your children, how old they were, and what health concerns they were struggling with.
Okay, I have two little ones. I'll start with my daughter. She's 5, and she was just shy of turning 5 when I started with Lauren, and she's almost 6 now. But she, from the time she was an infant, she had recurrent ear infections and some eczema, and we just a lot of medications, a lot of antibiotics, and even resulted in ear surgery when she was just over a year old. And not soon after the surgery, the ear infections still recurred, and they were even worse than before. And her skin, she was having these little skin irritations pop up. And she was also, by the time she got into school, she was catching every little germ and viral infection out there. She was just getting sick very often, and it was concerning to me. And so when we started with gemmotherapy, that's what I wanted to help with her ears and help with her immune system. And we quickly saw improvement with just one acute situation at a time. Gemmos cleared up very quickly. And then shortly after, the chronic ear issues just got a little better with each little flare up that she had. And
Actually, I want to catch you here for just a second. When your daughter was getting sick or had these inflammatory flare-ups, how often was this happening? Just to kind
several times a year, every few months, she was having an ear infection that resulted in antibiotics and or drops, and
and they were severe.
Yeah.
Right, Ashley?
Right. They would just getting worse. Sometimes there's a lot of discharge coming out of her ear, sometimes fever, and she, like I said, she was just in a lot of pain, and just brought her down. And the recovery took quite a long time. And then it seemed like she would clear up after that, and then she would have another one. So it was just, they kept coming back, and they were getting worse.
So Ashley, I know Megan was the first one that talked to you about gemmotherapy. Megan, did you describe to Ashley why her daughter was getting ear infections? Do you remember that?
I don't per se. Ashley, jump in with me, because you know my memory sometimes goes out the door. But I remember discussing your take on immunity and elimination, and how optimal elimination was vital to restore immunity. And I also remember your take on dairy. And so I want to say, Ashley, those were 2 points that maybe I had just brought up.
Yes.
Just in us kind of discussing gemmotherapy and what it was doing and all the things that Lauren had been teaching me.
Yes, definitely. And I didn't even consider that. That was a brand new concept to me about elimination and about what dairy products could do when it comes to health.
Right. So Ashley, was that an easy concept to wrap your brain around, that like your daughter kept having these reoccurring ear infections because her body was using her ear as an emergency exit? It couldn't clean. Her kidneys and her bowel were not eliminating enough and optimally for the body to clean. Was that difficult to understand?
No, in theory, it makes perfect sense. And the book really explains that very well.
Okay.
It was something I wasn't used to. Like I said, it was a brand new concept, and I wanted to really, I was anxious just to kind of see how it was going to play out. But in theory and in the book, it was explained very well, and it does make a lot of sense.
And Megan, you were the first one that talked to Ashley about dairy, right?
Yes, ma'am, I think so, because you were the first who talked to me about dairy. And, you know, it was like a lot of aha moments from you having the background of nursing that just made so much sense. Like, I just remember always going, aha, Philip, listen to this. This makes so much sense. And then starting to implement it in my own family and just seeing those successes. And so, you know, when you see success with your own, you just want to shout it from the rooftops and share it with the world. And so Ashley was game to listen. And so over a few months' time, I would just be like, I learned this from Lauren, and I learned this from Lauren, and listen to how much sense this makes. And maybe, you know, this is part of the reason why these recurring infections keep happening.
So Ashley, how was that, getting rid of dairy products at your household?
It was really tough. It was hard to kind of digest that and think about that, and to kind of figure out how I was going to do that, because it was a big part of our lives. And I definitely had to call Megan about it, and she was like, how do you do this? You know, and she was very resourceful, and she gave me lots of ideas and stuff. And but honestly, once I started doing it, it became very easy, and it became our new norm.
Right.
I remember that. I remember her diving in. We would send pictures. I'm in the store. Is this okay? Is this not okay? Which product do you use?
Yeah.
There's probably a week's worth of just random snapshots of boxes and products.
Yes.
But I remember 3 or 4 days in, she texted me and she was like, I don't know why I was so afraid of this. She was like, this is not a big deal at all, and this is 100% doable. And I mean, you don't know it until you try it, but it is. It's 100% doable.
So really, it was the story you created that this was going to be really hard. It wasn't the reality, though.
You're right. Yes. Because before I even started, it was like I had like anxiety about it. I worried about it. I remember I called Megan's sister, you know, one of my best friends. I was like, how am I going to make my daughter a birthday cake? Because I always make cakes. And she just talked me up and gave me a little pep talk. And I was able to do it. And I've done several, you know, birthday cakes since then, dairy free. And it's become, like I said, it's become our new norm. So it's fine.
Amazing. And, you know, I want to point out, Ashley, you're working full time. You're a teacher, and I was a teacher for 20 years. I know what kind of energy that takes. So you're working full time. You got a husband that's working full time. You got 2 little kids, and yet you were able to do this. And you're kind of saying right now, actually, once you got going, no big deal.
Exactly. Yes.
Yeah. And you stepped up and took the leadership role in your family, right?
Definitely. Yes.
Okay. So let's then go into, we had this period where there were these acutes occurring every couple months. And so then you eliminated dairy and you started a gemmotherapy protocol to improve elimination in your daughter. And what kinds of things did you start seeing?
I definitely saw very quickly that first little acute, she had coughs, colds, things like that, that in the book, the protocol for that acute situation, we saw very quick results with the acutes. And then a few weeks later, we might see that acute come up again, another cold, another cough, or maybe a little stomach bug. And we used the protocols again, and those acute situations went away even faster and more effective. So she bounced back faster. I noticed, and you know, without the dairy too, I believe that really cleared up things. The nose just didn't run for days and days and days, and the cough didn't linger for days and days, and everything, mood, energy, appetite, just with those illnesses. At first, when I saw those things decrease, she just improved with all of those areas much quicker than ever before.
Fantastic. And you know, Megan, this would be maybe a good idea to have you kind of explain this for everyone. So Ashley, what your daughter had was really a chronic situation.
Yes.
It was a chronic situation with acute flares. And so there's a way we work with GMOs with that, and we have 2 different protocols. Do you want to kind of explain that for everyone, Megan?
Absolutely. So our bodies are insanely intelligent, and they are self-healing if they are cleaning properly. So I love to associate it with a home that's dirty. If you're like me, my home is dirty, you cannot just kind of relax and just feel clean. And the same thing is with your body, and the way our body eliminates is by stools and how optimal they are, and also by urination, and our menstrual cycle if you're a woman. But in discussing kids, it's what does their poo look like? How often are they going? All of those things are very, very important. And the same with their urination. How often are they going? Is it frequent? Are they going in the middle of the night, depending on their age? And these give us large pieces of information to what is actually going on in their body. And if those elimination channels aren't doing their job and doing their job the way that it was designed to be done, then you have a dirty house. And in a dirty house, things start to smell, and trash starts to overflow into areas that it wasn't meant to be, because it's coming out of pouring out of the trash can that's too full. So think of your GI tract as being too full, and that trash is starting to overflow, whether it's skin issues or chronic colds or ear infections in Ashley's daughter's situation. And so actually the way that we get a handle on these acutes is we start to identify and support the chronic issues. And the way that Lauren does this is by starting with the nervous system gemmo, because the nervous system is the communication for the body, and it speaks to every cell in our body. And then we support our kidneys, which helps our stools. And then we also support our adrenals, which are the directors of a lot of functions in our body. And implementing this chronic protocol, you will greatly see acutes improve. And then when those acutes show up, you use those acute protocols just to support those organs or that tissue in that moment in time. But you will see much faster results, like Ashley's talking about. I mean, it's a night and day difference, guys. And I don't say that being extreme or kind of exaggerating. I mean, it is completely night and day. Wouldn't you say, Ash?
Yes, definitely. And when those acute, like we said, those acutes would come up and they would just go away faster, and she would heal faster. And then we would see those ear flare-ups get further and further apart, and less and less. And now, when there's a change in weather, or she has a little sniffle, I'm not automatically thinking, oh my gosh, it's going to end up in an ear infection.
Sure.
And because I know what to do.
Yeah, I love that. I love that. And Ashley, also, you've learned to read certain symptoms in your children that occur before physical symptoms happen. Do you remember any of these things that you're watching to see if they might be getting sick?
Especially with little ones, I would say mood.
Mood, right? And then
they're a little extra cranky and
right.
Things like
And
that.
then what about their appetite? What happens to appetite before they start getting sick?
It decreases. They're not wanting to eat their normal amount.
Right, right. And those are really good symptoms that appetite, mood, and energy.
Yes.
Yeah, so those are the things that we're actually using to measure sickness. So we get so hung up on this cold that's draining, or the runny snotty nose and this congested cough. But it's actually mood, appetite, and energy that we're using as measurements of, are we getting sick? And then those same exact tools are we getting through this sickness and getting well? Which has been eye-opening for me as a mom, and teaching other moms that now when you start to see that mood change real quick, you're like, uh-oh, wait a second, are you getting sick? And you'll observe it for just a little while, and you're like, yes, you are. No, you were just hungry, kind of thing. And getting that jump start in those supporting implementations, whether it's rest or warm baths or, just fruit diet, and starting gemmo protocols drastically changes things.
Sure. And Megan, I've got a great plan in the children's book, Building Immunity in Your Babies and Children, that teaches moms what to do immediately. And this puts you in such a powerful place. We don't have to just wait and sit like, oh my gosh, here it comes. And it's just like what's going on right now with this virus. We don't have to wait till it finds us. We could be doing amazing things right now to be supporting our immune system. So I don't want to leave your son out of this, Ashley. We've got just a few more minutes, but if I remember right, we were dealing more with emotional issues and working with this nervous system. So do you want to share a little bit there?
Yes, my son, when he's 4 now, but when he was about 3.5, I started with Lauren, and my main concerns with him was he is a very active toddler, but he was kind of showing these things where his hyperactivity would he would get hurt. He was climbing on every single thing, jumping off of every single thing, and just a lot of hyperactivity, and just needed to get that energy out. And I just kind of was concerned about him going to his little daycare and, you know, in the future his school. Like, I didn't want those things to affect things like that, and his safety. He was also having some sleep issues. He was having a very hard time settling down and going to sleep. We would have to sleep for a very long time and just pray that he would stay in his bed, and most of the time he didn't. So going to bed took a long amount of time. He was getting up in the middle of the night and then waking up sometimes before 5:30 in the morning, just ready for the day. And also some behavioral issues. And he was, when he would break a rule or get something taken away, he would show a lot of aggression sometimes, throwing things. And society may tell us that's what a toddler does. But when it's affecting the whole house, and it was giving the whole house just kind of this stress level, I just knew that I was hoping, and I knew there was another answer out there. And so with the protocol with Lauren, and a well-chosen remedy also, so gemmotherapy and a remedy, we saw results, and he is a completely different child. Megan knows. We would go to her house and have play dates with her little boy, and she's seen the transformation herself too. And my husband and I both, just in every single area that I just said, he has improved. It's been magical, and he's still his active little self. He's not, his personality is still the same, but he just channels his energy so differently, and he's more compliant, and he sleeps better, and everything is just so much better with him. We've seen a complete transformation.
Wow.
I love this because Ashley actually texted me. It was 7 days ago at most, maybe 4. And she said, I have tears in my eyes right now because the changes that we have seen with him have been so drastic and have changed all of us. And she said, I am getting to enjoy my little boy and getting to love his personality and watch it bloom, and getting to experience all the way that he views life and with him. And she was just so full of a mother's love in her heart, and not this string pulling of, I love you because you're my child, but oh my goodness, what am I going to do because it's making me want to pull my hair out. Oh, she has tears in her eyes right now. But y'all, it was just so awesome to hear, you know, where they started in his hyperactivity and behavior issues, and where he is literally today, and the changes that have taken place.
Oh, I love that. What a beautiful testimonial from both of you. And mamas out there listening, let me tell you, sign up for my Restoring Your Immunity Nervous System class. It starts the 1st of May. You will learn so much about your nervous system and how responsible it is for behavior and emotions and sleep. Ashley, you didn't make gigantic changes with your son. You're giving him a couple drops of Gemmos, right?
Exactly. Yes. And microdosing. Yeah. Just little things and little drops when we see just a huge, huge difference with him and in our whole house.
Right. Right. Harmonizing this nervous system is so important in today's world. And as adults, we can understand this, but we've got these little children and beings here that come in for one way or another with their nervous system out of harmony. And there are options out there allopathically, but they're going to suppress your child. And they're going to be something that eventually we're going to have to do something about, because we can't suppress a little being through their whole developmental stage. And so gemmotherapy offers such a gentle, natural approach where we're really reminding the nervous system how it's supposed to work, how it is meant to come back into that place of rest and digest so the whole body will work appropriately. Ashley,
Right.
thank you so much. Megan, you want to share something before we wrap up today?
I just want to tell moms that there's nervous system extracts for you too. It's for everyone. And while, as we as moms put our kids first, and that's typically who we sign up to be treated, I see the most success when mom starts taking care of themselves.
Fantastic. Thanks, Megan. Ashley, any last words for moms?
Just kind of, in your gut when something's not right with your child or when they're suffering either emotionally or physically, and don't ignore that. And gemmotherapy can be the answer for you.
That's beautiful. Ladies, again, thank you so much for joining me. Ashley, thanks for sharing your family story.
Welcome.